Well, healthcare reform is certainly something that's a hot topic these days, and it's going to impact your bottom line of your small business. I'm here this morning with Paul Goff, financial advisor and healthcare expert with the Puffenberger Financial Services and Insurance Agency in Warrenton, Virginia. Good morning, Paul. Tell us a little bit about you and the Puffenberger Agency.
Thank you, Jamie. It's great to be here. The Puffenberger Agency, we do one good way to say it is we do everything under the insurance and financial umbrella except for individual stocks. So
Okay.
we handle property and casualty, life, financial. I'm on the life and financial side of things. I handle annuities, mutual funds, life, disability, long-term care, and kind of wrapping myself around this is the health insurance part of things, and that's an additional thing that I've done in the last year or so. I've the very complex subject that I'm trying to learn more about and then get more educated about, and all the ability is the end line is to help my clients understand what's best for them.
Paul, one other thing, we got this election coming up. We're sitting here in the end of September. Yeah.
Do we?
Have you heard?
I haven't heard.
You
yet.
haven't noticed? I haven't seen those commercials on your TV and your iPhone and everything else where you see commercials?
That's right.
Yeah, so, with that coming up, certainly things are probably going to be adjusted and changed, but really, what do you see as healthcare reform in the future over the next 2-3 years? And if, you talked about 2014 kind of being one of the big things, and, if any, will the election have any impact on that, and if so, what?
In my opinion, that election, it will, if either way, it's long term, it's very going to be minimal effects on it.
Okay, why is that?
Because we've come a long way, whether on which side of the fence you're on, it's come a long way. We've taken a long time to get to where we are with healthcare reform. It will take a long time to back away from that.
Okay.
If, let's say, for example, if Romney is elected, it will take a long time to get away from that. And I don't think at this point, the way things are set up, that either politically for himself or I just don't think that he's going to pull that back very much, if at all.
So the day after inauguration, if he would be elected, you're not going to see a automatic repeal?
Yeah, I don't think you're going to see much of a change of anything. I could be wrong, but I really don't think that much is going to change as far as the health care. It's becoming, don't like to put topics, or labels to it, but it is more of a socialistic form of medicine.
Right.
That is not that we're socialist, but it's just that it's coming to that more kind of, and some people feel that that's the better way with healthcare. That's the better way to take
and to make sure everybody has it. I mean, it goes back to that.
Correct.
Making sure a higher percentage of people have the healthcare.
Right.
Okay.
The end result is if you have deniable conditions, pre-existing conditions, it is going to be a situation where you will be able to get coverage, albeit at very high prices.
Okay.
That's not part of this. There's no guarantee on your prices being.
There's guarantee of coverage, but not guaranteed on pricing.
You sure are. Just like you can get auto insurance wherever you can. It doesn't matter how risky you are. And the medical cost will go up for the small business owner. Yeah.
Okay.
Yes.
And so as this kind of falls out, even whether it changes or doesn't change, or let's assume it's not going to change too much, over the next 3 years, kind of how does it get implemented and how do things change? And
well, it's slowly going to come. It's going to come in. There's a timeline. What's happened is a lot of the companies have already put some of those, some of the items that are in the reform into effect already. If you're 26, up to your 26th birthday, you can be on your parents' policy. As long as you're not married, you don't have to live with your parents. You don't have to have, you can be away as long as you're, not married and you're up to your 26th birthday. You have coverage.
I thought you were even covered even if you were married. So the marriage thing is not.
No.
Okay.
If you're married, then, but you've got, and it's just the preventive care, which you're covered. That's already started to come in. So there's lots of things. And the thing too, be sure when you're looking at health, you're looking at your options there. Don't really think of that preventive care as being free. You have your co-pays if you're your well visits and your mammograms, your PSAs are taken. Or the co-pay is zero, is like the way I'd like to say it, but that will be somewhere that will be put in your premiums, obviously.
Okay. Okay, great. So, Alyssa, any other questions?
Should I just pay my employers more and let them pay for their own coverage, or continue with the group plan?
Yeah, so that kind of goes back to the other aspect of it. As you look down the road, do you see that employers are going to kind of just start abandoning the group because, or we've heard about some penalties, that maybe I should not pay insurance, just take the penalty, that'll be cheaper, and then pay the individual? I mean, how do you see that kind of working out?
I see it as employers are just going to have to, it's going to have to be a part of their overhead and a part of their expenses to do business.
Okay.
It's going to be, there's so much more involved in getting the employees all on individual coverage. There's so much more that, as we're talking about, you can't ask your employees, their personal details of their health history.
Right.
You can't even ask them if they smoke. Well, you probably know that, but you can't ask them how much they drink, how much they do certain things. So when you look at the overall perspective, it's going to have to be a line item in your budget. It's going to have to. It's part of doing business, again, responsible for at least 50% of your employees.
Okay.
Yeah.
Well, great. One last question, I
Sure.
guess, before we kind of wrap it up here. But we talked about the insurance companies and the companies. What about the medical industry itself? As far as doctors and how do you see this affecting how insurance companies pay doctors and the value of different specialties and that type of thing? What do you see happening there?
Well, there's already been an initiative to try to get at the PCP and the family practice level. Medical students know coming out of med school that the orthopedic surgeons, the neurologists, the neurosurgeons, those people are making over twice as much as some of your PCPs and your family practitioners. There's going to be a push by the healthcare industry to incentives to have the care set there at the family doctor level. It's a very complex situation, but they want the PCPs to hold their patients responsible for the exercise, for their nutrition, for their drinking, for their smoking, all those things. A lot of what goes, and it's one of those things that 75% of healthcare costs are from chronic diseases. Yes, a lot of that you can attribute to just unfortunate genes and just being unlucky, or some environmental causes, but so much of that, and it's hard to pinpoint what that is just general lifestyle. I mean, children today are just not as active as they used to be. Many reasons for that, good and bad, but it has taken away from just the physical nature of people, and the PCPs have to be there at the front line before it goes to the more expensive. I mean,
so kind of as a filter, so the primary care physician, the PCP, they're going to be kind of filtering that aspect of it to make sure that we...
Right, and there'll be financial incentives for them to do so.
Okay.
I'm not sure about the specifics of that, but that's what the healthcare companies are trying to do.
Okay. Well, this is going to be some big change for us in the healthcare industry and in healthcare reform over the next couple of years. Paul, thanks so much for being with us and
great to be here.
And sharing with us just a tip of the iceberg, I'm sure, of the complications and the information on what we need to look to as small business owners. Certainly, if you enjoyed this segment and learned something from it, then please share this with your friends and your colleagues. We are here typically every Friday morning at 11 o'clock in the morning. But most of all, be better at business.